So why dance? I used to be a dancer myself, a professional dancer and a dance teacher. I used to dance ever since I was a little kid, and I personally find it very enjoyable, and I don't particularly like going to the gym and lifting weights and running for 40 minutes on a treadmill. And a lot of people struggle with that as well. And one of the biggest challenges for a lot of health professionals is trying to get their patients to be more physically active. And if we can find a modality of physical activity that is more enjoyable, if that happens to be dance, that is something that they do recommend, but we haven't fully understood the true impact and effect of what dance can possibly do on health. So a previous study of ours looked at the physical health outcome measures and found that structured dance can be equivalent to, and in some cases more beneficial for, improving physical health outcome measures. This new study is focusing on the psychological and cognitive benefits, and again we have seen that it is equivalent to, and in some cases slightly better at improving psychological and cognitive outcomes. What this means is that clinicians can be a bit more confident now in recommending dance as a suitable and effective alternative physical activity for their patients, and they will be able to swap out a session of standard physical activity, going for a walk, going to the gym and lifting some weights, going and doing some sport. They can swap that out for a dance class if that is something that that patient is going to be interested in. Out of the literature, there was a predominant bias towards studies with participants aged 55 and over. There was a bigger focus on cognitive outcome measures, which is reasonable given that there is a focus on cognitive decline with age. The participants that were 55 years and under, there was much more focus on measuring outcomes for psychological health. And so what we hope that this paper will do is to stimulate some research in this field that is going to try and even out that balance so that there's more cognitive measures for those younger age groups and some more psychological measures for the older age groups as well. I think that dance has something extra special. We don't really know what it is. I think that we know that physical activity has its benefits. We know exercise is medicine. We also can see in music research that music has something that is working in the brain that can improve psychological and cognitive health as well. Dance brings together both of those. So for one, dance is potentially a physical activity that people don't see as exercise. So if it's exercise in disguise, they're more likely to do and continue with their exercise and their physical activity. If they enjoy it, they're going to do it for longer. And adherence is that big challenge that we really try to overcome. So if you enjoy it, you're going to do it for longer, you're going to get these physical health benefits for longer, and the psychological and cognitive benefits will come too. I think if you haven't tried dancing, find a piece of music that you enjoy and get moving.